Oral rehydration solution. The World Health Organization in 1971 introduced ORS to prevent dehydration to decrease mortality. Glucose given orally enhances the intestinal absorption of salt and water. So it corrects electrolyte and water deficit. So how to prepare ORS? In rough terms, 2.5 grams of sodium chloride, 1.5 grams of potassium chloride, 3 grams of sodium citrate, 13.5 grams of glucose. All of these are added, which makes total of 20.5 grams in 1 liter of distilled water. That's how ORS is made in easy terms. Looking at the osmolarity of ORS, the standard ORS has sodium concentration of 75 millimole per liter, glucose 75 millimole per liter, chloride 65 millimole per liter, potassium 20 millimole per liter, and citrate 10 millimole per liter, which totally sums up to 245 millimole per liter. In simple way, homemade ORS is made by adding 20 gram of sugar and 4 gram of salt in 1 liter of water. There is a other variety, Resomol, which is used in severe acute malnutrition, wherein there is increased potassium and decreased sodium. The glucose is also increased. So since the sodium is decreased, it is 45 millimole per liter, glucose 125 millimole per liter, chloride 70 millimole per liter, potassium 40 millimole per liter, citrate 7 millimole per liter, magnesium 3 millimole per liter, which totally sums it up to 300 millimole per liter. Indications of ORS: dehydration. So any condition causing dehydration such as diarrhea, vomiting, excess sweating can lead to loss of body water. So we have to replenish the fluid loss. Signs of dehydration such as sunken eyes, no tears, dry tongue, thirst, restlessness is seen. So looking in depth of diarrhea, the causes of diarrhea such as cholera, Shigella, E. coli, amoebiasis, vomit, hypovolemia, excess sweating, inadequate fluid intake. How do we administer ORS? So ORS administration in first 4 hours. Age 0 to 4 month 400 ml, 4 to 11 month 600 ml, 1 to 2 year 800 ml, 2 to 4 year 1200 ml, 5 to 14 year 2200 ml, 15 plus years more than 15 years more than 2200 ml. Guidelines says child less than 2 years to be fed by using teaspoon every 1 to 2 minutes. If vomit occurs after 10 minutes of vomit, teaspoon every teaspoon 2 to 3 minutes. Looking at advantages of ORS, ingredients are inexpensive, readily available, easy preparation, simple, safe administration, prevents hospitalization, no side effect. Disadvantages include ORS can't be given to those who are vomiting and who are unconscious. ORS can't be given to those with glucal malabsorption syndrome. Importance: ORS most important discovery of 20th century. And to summarize the entire ORS in a single sheet, we look at the composition, osmolarity, indications, advantages, disadvantages.